Welcome to Chick Chat with Unapologetically Karen, the podcast for women by women. I'm Karen Webb, architect, author, entrepreneur, creative junkie, and your host. Chick Chat is your resource for building your big, bold, and beautiful feminine life. So join me for some eye-opening and jaw-dropping dialogue that has people talking. Welcome back to Chick Chat. Today's guest is Amy Gutman. With over 3 decades of clinical, corporate, and research experience, Dr. Amy Gutman, MD, FACEP, is board certified in emergency medicine with fellowships in pre-hospital care, resuscitation, and specialized certifications in general surgery, maritime medicine, administration, leadership, occupational medicine, and nutritional and ketogenic coaching. Wow. She is an attending physician. It's a lot, right?
Yeah.
She's, and am I saying it right? Gutman?
Yes,
Is
ma'am.
that perfect? She's an attending physician at Advent Health in Orlando and CEO of ToughLoveMD. I love that name. A private practice specializing in optimizing physical and mental health through evidence-based medical practices. Dr. Gutman is committed to positively impacting patients' lives using science-based strategies with real-life applications. She has spoken to thousands of conference attendees across North America and internationally, and she is dedicated to utilizing transformational medical science to empower personal and professional resiliency. Her passion lies in reducing the prevalence of debilitating chronic illnesses and empowering individuals to thrive mentally and physically, transforming into resilient powerhouse leaders. I love that. I want to be a powerhouse leader.
Oh, who doesn't? Who doesn't, right?
Absolutely. So very interesting. So let's kind of get started with, how did you start this when you went into medical school? Is this what you went into for, or did something happen and shift over?
No, I actually never really intended on being a physician. I wanted to be a fire chief. I grew up firefighter EMS.
Oh,
And you sort of do different things along the way. And obviously I've had a random path. And I don't know if you know many emergency physicians, but very few of us are like, I'm going to do this and then I'm going to do this. We're all sort of like goldfish. We're always sort of looking for something else. But about 2 or 3 years ago, I had been working out of the country and we moved back to the States. And I found myself more and more frustrated in the emergency department by just putting Band-Aids on things.
mm-hmm.
And there's always sort of that, I'm going to hold my beer and watch this and fine, that's great. And I like fixing things, but about 85% of what we see in the emergency department is chronic disease. And
Yes.
it's very, very frustrating because we have physicians in general, clinicians have very little time to talk to their patients. There's very little preventative care. It's sit down, type in a computer, what drug do you need? What refills do you need? Here's your blood test, blah, blah, blah.
Yes.
And about 1.5 years ago, I had been a lifelong vegan, 37 years, and I
Wow.
had a bit of a health crisis, and everything kind of went wrong at once. And I'm like, oh, it's menopause, but everything went wrong. And for the first time in my life, I had a very hard time actually keeping on weight. I'd always sort of been battling that.
Oh,
And I just was sort of wasting away and got to the point where I couldn't eat anything. I was chronically sick, and I'm the primary caregiver, moneymaker in the house. My husband is wonderful. He's a stay-at-home dad who is a nurse, but I'm the only one working. And I'm like, I got to figure this out. And I'd stumbled upon randomly an article about menopause and ketogenics. And I thought it was the most ridiculous thing. Again, lifelong vegan.
Yeah.
And at that point, I'd started eating some fish, and the only thing I could eat was fish and cantaloupe. Everything else was just horrible. And one day I said to him, I would like to eat a hamburger. And he's like, we're getting your head scanned. That's it. That's it. We're getting your head scanned. And
Yeah, right.
yeah, and I had spent about 3 months literally researching, just trying to look at the evidence, and because I'm very evidence-based, I'm like, I don't see the downside. I'd like to try it. And it was literally within days, I kid you not, within days, things started to change. It
So
was
let me ask you first,
Yes,
what
ma'am.
made you decide 30 some years ago to become vegan?
It was one of those, "Hey, I love animals."
Okay.
We'd always had pets and things. I'm like, "This must be better for the animals, and therefore it's better for me." If it is, "Oh gosh, that's bad for you. It's unhealthy. It's high cholesterol." It's all the things that I think very well-meaning people think. And I think veganism and ketogenics actually cross very nicely, because as long as you removed all the processed foods from things, the
Yes,
ultra
yes.
processed foods, I think we have a very lovely common ground. But for me, it was one of the things that I didn't realize, that about 40,000 animals per acre, because the insects, the animals, the little
Yeah,
hamsters, I don't know what,
yeah,
groundhogs,
right.
it's ridiculous amount of animals are killed in the pursuit of a vegan lifestyle. It's really not cruelty free, as
Really?
it's
Interest.
it's really really interesting when you
How
look at.
so? How does that happen?
So when you're farming,
Mhm.
so when you're doing grain, they have combines. Combines don't stop for bunnies. They don't stop for
Mm,
groundhogs. They don't
I
stop for
see.
birds. So it's a ridiculous amount of animals are harmed or killed for vegan type food, for
Vegan.
grains and things like
Right.
that.
I see.
Frogs and all sorts of different
Yeah.
things. So it's really not quite as cruelty free as many people think, although we'd like to believe that. And interestingly enough, a lot of the animal based lifestyle is actually about as cruelty free as you can get. So it's a really weird mindset. But when I stumbled upon this change for myself, I'm like, this is crazy. I had been on medication almost my entire life for thyroid, for all this, for all these different things. Within about 30 days, almost a complete reversal of all of my
Wow.
symptoms, like
Wow.
debilitating. Blood work showing my laboratory for the first time in almost 40 years. My labs were absolutely normal. I did
Wow.
not believe it. And I'm like, this
Yeah.
is ridiculous. So I'm going to research more.
Mhm. Mhm.
And then when I did more research and saw that the evidence was very sound but very buried, you turn into a bit of a conspiracy theorist, and you're like, you wear your little hat. You're like, why do doctors not know this? Why do I not know this? And I consider myself a fairly well-read person. You can
Mhm.
tell that I do not stick to one thing I want to know this. I want to know this.
Yes, I get it. I'm the
Yeah,
same,
yeah,
right? Just bring
absolutely.
all that not soak in as much as you can,
Well,
right? Yeah.
architecture is as much of a STEM field as traditional STEM
Yes.
fields. It's
Mhm.
math and physics and science. It's really interesting, actually.
Mhm.
And but you're curious. You want to know why this works, and then you start looking at the other information around it. And I just became even it's harder in the emergency department now, because I'll have diabetics who are told to, oh, have
Mhm.
apples. It's really good fiber for you. I'm like, oh my gosh. The American Diabetic Association says, having oatmeal with cinnamon sugar and pasta, high sodium things, it's sponsored by DaVita.
Mhm.
You find out the sort of horrible, these conspiracy theories are not really conspiracy theories.
They're not. I believe in
They're
them
not.
absolutely. Yeah. And
They're
yeah.
not.
So basically they are causing us more harm so that they can give us more medication,
So
right?
it's very interesting if you look at a lot of the manufacturers. So a classic example is like Nestle Food Company.
Mhm.
So Nestle Food Company has all these little subsidiaries. But one of the things that's really interesting about Nestle Food Company is they also make baby food.
Mhm.
And when you look at baby food, when you look at sugar content of baby food, it's palm oils, seed oils, sugars. But if you look actually in the United States versus overseas, the sugar content of these baby foods is so much higher in the United States. So
Wow.
what are we doing by feeding seed oils and sugars to our babies? We instill upon them this sense that, ooh, we like sweet things.
Yes. And they're
And
forever stuck there,
exactly,
right,
you're
going
in
for the sweet.
thrall. I
Yes,
know, I
yes.
know. And it's a challenging thing because the conventional wisdom is, oh, the ADA is a good organization. But yet since the ADA came into play, diabetes rates have skyrocketed 70%, like 70 times
Wow.
greater. The AHA, let's put it this way. There's most of the people on the boards of many of the government agencies. In fact, the majority of people, I think Kelly Means and Casey Means, they're physicians, brother and sister. They've been in the media a lot recently with
Okay.
RFK.
Yes. I was just gonna bring that
Yeah,
out in a minute. Go
absolutely.
ahead.
But
Mhm.
they have they published some statistics that it's about 90% of the people on the board of the FDA come from a pharmaceutical
Mm.
or medical conglomerate.
Yes.
It's very, very
Yes.
hard to argue with that data, especially when these are the people that are writing the guidelines that tell us what to eat. So you can see
So
that as a
true. Yeah.
physician, yeah, as a physician, I love patching boo-boos. That's what I love to do. I love
Mhm.
critical illness and jumping in and working as a team and really making a difference. But I'm finding more and more it's not making a difference. It's just give me more meds. I
Mhm.
want more of
Mhm.
this. Oh, the Manjaro doesn't work, so let's use this. Let's do this. Oh, I failed my gastric bypass, so let's try this. And we're not addressing the root causes. So my kind of veering into this more private practice and lecturing and teaching
Mhm.
is trying to change people's minds using evidence. Not because if I told you, LDL cholesterol is fine.
Yeah.
LDL is great. Actually, cholesterol is fantastic for you. And one of the reasons that we have dementia in this country is cholesterol is actually cut down. Oh, you're making a face. So,
I
right, right.
what?
All
Okay,
right.
yeah.
All right. So here's the thing. You're like, oh, this doctor's gone off the deep edge. Well,
No, not at all. I'm curious. But wait, there's just to clarify, there's
yes, ma'am.
LDL and there's the two types, right? So
Yes.
they
Well,
consider one the good and then the other not. What are they
so
exactly?
there's HDL, so high
Okay.
density lipoproteins, very
Okay.
low density lipoproteins, VLDL, HDL, which everyone says is the good cholesterol, HDL, high
Okay.
density. But so if you think about let's just talk about cholesterol for a second.
Yeah.
So, do you think mothers who breastfeed their babies are trying to kill them?
Clearly not. No.
Clearly not, right?
Yeah.
What is breast milk made out of?
Colostrum, right? I
So
don't
it's
know.
cholesterol and fat.
Okay. Okay.
Why? Because every cell in your body has a cell membrane. Think back to like third grade, fourth grade,
Oh yeah.
right?
Mm-hmm.
It's
Mm-hmm.
made of cholesterol. Your brain is made of cholesterol. Your nerves are encompassed by cholesterol. In
Okay.
this country, there was very little dementia before one type of drug came on the market. What drug would that be? Well, those are a class of medications called
Statins.
statins.
I knew you were going to say that, and only because I'll share with you after I just
Yes,
went through this experience. But go
it's a
ahead.
very interesting
Yes.
thing.
So statins then have really created the dementia issue.
They have actually dementia is
Wow.
considered diabetes type 3 because most diabetics have dementia. And what's interesting is patients who are on statins. So the average lifespan that's increased by statins for patients who have been on it 20 plus years is about, for men and women, I'm going to have the exact numbers wrong, but it's between 3 and 4 days. That's the average lifespan increase for 20 years, 2 decades. I think
Oh
men is
my.
3 days, women are 4 days. I might be mixing it up. I don't want to give incorrect facts, but it's about 3 to 4 days. So the problem is If you need cholesterol to make your nerves function, and
Mhm.
your brain is full of nerves, and now you're not letting that cholesterol coat those nerves, what happens? Neurodegenerative disease,
Yes,
Alzheimer's, dementia.
yes.
And so
Wow.
before statins, like there was like, okay, every now and again you'd have somebody who would have a rare, skyrocketed, skyrocketed. And there's some really interesting data, and not just anecdotal, but reports, multiple, hundreds of reports. You take people off their statins, and within weeks, their memory improves, their Alzheimer's improves. It's fascinating.
Wow.
It's fascinating. And what does every person do? Is, oh, you got to be on a statin. Well, here's
Yeah.
the thing. Of course, there's cholesterol when you have a heart attack or a vascular problem. Why? Because if cholesterol is a building block for a cell membrane, if you have an injured cell or an injured vessel, what's the first thing that goes
Mm,
to it? Cholesterol. It's brought there to
I
fix it.
see.
You're blaming the firefighter for the
Wow.
fire.
Oh my goodness. Wait, well, that is amazing, Amy. I'm just like,
It
so
blows you
this is,
away, right?
it blows me away because, especially because, so my situation with this makes me just go, wow, you've just answered all the things that didn't make sense to me. Um, just recently, my mom passed away a couple of years ago and had a heart
So
condition. And
sorry.
yeah, it was awful and really bad hospital care, I think, during
Mm,
COVID. But I usually get my body type, everything I usually get. So I recently went in for like just to really check my heart, which I had never really done. And she
sure.
had she had had a valve replacement, etc. So they checked all that, and then they checked the cholesterol. And I eat really, really healthy, mostly a paleo diet. But and I love my
Fantastic.
meat, and I love my meat. So there's no way I could do vegetarian. I don't feel well when I don't have meat. But when it came back, they were like, "Oh, your cholesterol is very high," and I'm like, "I don't eat any processed foods. Like, what
Hmm.
could it? I can't change my eating to be better. What could I do? I just more exercise. I do exercise regularly. I didn't know." So, and of course, the cardiologist that saw me was like all about, he was dead set on putting me on a statin. And I really don't like a lot of those type. And I just,
Right.
my research on it, and I was like, I don't want to go on the statin. And so I said, I'm going to do a few things. I'm going to take what I had researched was, oh goodness, berberine, I
Hmm.
think,
Yeah,
and the beet stuff, like super beets.
sure.
And I'm going to exercise every day. And then we'll retest. We haven't yet retested, but I refuse to go on that statin. And now hearing what you're saying, it makes perfect sense. Yeah.
The side effects from the statins are pretty horrific in general.
Yes.
And the thing about, so the whole myth of LDL being bad came from a study that was funded by a drug company to the
Mm.
AHA that said, oh, LDL is bad. There's really been no replication of the study. It's a scientific myth, and everyone believes it.
Oh my
And it
gosh.
doesn't mean, so here's the thing, I don't truly believe that doctors are ill meaning.
I
There's
don't
no,
either. I don't think the
no, I
doctors
don't.
are at
No.
all. No.
And
Mm-mm.
again, I consider myself a very, very educated physician. And so I'm 35 years into a career. Now it wasn't always as a physician, but years into a career going, I don't understand why I do not know this.
Yeah.
I have repeated that lie to patients over and over and over for decades,
Right. Because
but
you thought
I thought it was
that
true.
was the study. Yeah.
Exactly. And it was a very interesting thing, the statement that someone said to me, well, breast milk is cholesterol. Are you trying to kill your child with breast milk? No, obviously you're not. So if it's good enough for a child, why are
Mm-hmm.
we putting it into this bad category? I'm like, well, that doesn't make it, you're right. That doesn't make any sense whatsoever. So you kind of go back and you realize that the one study that tipped over LDL, it was an AHA, it was funded by a drug company and said, oh, it's a
Mm-hmm.
terrible thing. And the problem is, it's not fat. It's never been fat. Fat is actually one of the healthy things that we can eat. It's very evolutionary. You have a paleo diet, you understand.
Mm-hmm.
It's sugar.
Mm-hmm.
Sugar is a horrible pro inflammatory food
Yeah.
that, there was a very interesting graphic that came out today from, and I apologize, it's one of the major like government organizations that said it is acceptable for children to have up to 6 teaspoons of sugar daily, but no more than that. And I'm like, 6 teaspoons of sugar daily for a child.
That's a lot, I
First
would
of all, it's
think.
a lot for everybody.
Yes,
But
yes.
and that does not even include fruit juices or sweetened things of that
Oh my
sort.
goodness. Wow.
And all we're doing is promoting diabetes and
Mhm.
promoting an
Mhm.
inflammatory state.
Mhm.
So paleo diet. Let me ask you, what turned you towards that? Obviously, you like meat, which is fantastic. It's incredibly healthy for you. But I'm curious, what brought you to the
Yeah.
paleo diet?
Um, well, a combination of things. Part of it was that I started to realize I'm intolerant to gluten.
Mm,
My Pilates instructor had said, I think you have a gluten issue, just
mm-hmm.
from what I had been feeling and what was going on. So cutting that out, I don't eat a lot of carbs
Mm-hmm.
because, some of the gluten stuff is getting better. The gluten-free stuff is getting better, but it's not like I crave, a
Sure.
gluten-free anything really. So that eliminated a lot. And I know I need meat. So, because I know for me, like if we go for a week, my husband usually is the one who cooks. He's a great cook.
Oh, that's
And
wonderful.
yes, I make the salad and he's the, either the meat, the fish, something. But if we do a week, let's say, of chicken and fish, usually by the end of the week, I'm not feeling as good. I feel a
Mm,
little sluggish. I feel a little, I want to say anemic, though I'm not, you know what I mean? So I don't think
sure.
I would be, but I just don't feel up to my strength that I usually do. So I know for me, like I do need to have red meat
Yeah,
once a week, or I just don't feel right. That's pretty much. And then based on that, just wanting to be healthy,
sure.
once you start that direction, you know, and then wanting to get rid of preservatives and everything, it just, yeah. So that's kind of how I ended up with the paleo versus anything else.
And it's such a healthy way of living because essentially, if you remove processed foods
Yeah.
and you eat sort of in an evolutionary manner,
Right.
that's, I mean, if it sustained us for thousands of years, obviously it makes sense. The rise of cancer in the younger set, it's an incredible rise in 20-year-olds,
Hmm.
30-year-olds, 40-year-olds getting these horrible cancers, primarily GI, but an awful lot more is almost the data is very, very sound, but it's not overwhelming. They always are overwhelming, but it looks
Hmm.
like it's going to be all uh, ultra processed foods and seed oils, which of course are just industrial
Right.
lubricants. And we're poisoning ourselves as a society. And it's not like we all have to, be at CrossFit 4 times a week and do all the
Right.
crazy things. But if you eliminate processed foods, if you eliminate artificial sweeteners, seed
Hmm.
oils, and you just eat a very evolutionary diet,
Hmm.
you are
Hmm.
literally 95% of what you need to do in life. Your body will figure it all out after that. And the really lovely thing about a paleo diet, and I'm sure you've noticed that, or a ketogenic diet of
Hmm.
all these things, you don't crave
No.
crud.
Mm-mm.
You don't. You're
Right. No.
full. You're nutritionally full. For me, I intermittent fast. It just works for me because I come home, I work night shifts. And so my breakfast is everyone else's dinner, but I'll
Right.
come home and I'll have, some ground beef, some eggs, maybe a piece of cheese.
Yeah.
We call it dessert cheese in the family if I'm
Oh,
feeling
there you
particularly
go.
feisty. And you don't want to, you're like, oh, and
Yeah.
I literally would eat an entire loaf of bread. Like I would love a crusty bread. And
Hmm.
I don't crave it anymore because you're
Yeah.
full.
The
So
only
it's a
thing I
really interesting.
crave, the
Mhm.
only thing I crave, and I just think that's never going to go, is dark chocolate. Like I crave that.
I'm
That's
lucky.
my one
I'm
thing.
lucky. The only girl in the world who does not like chocolate. So,
Really?
but
Oh,
I don't. It's a texture thing.
oh, is it?
But
Yeah, no,
here's a little thing about dark chocolate. It does have something called L-theanine in it. It's actually a bit of a very healthy thing to have. So having I feel, and I'm not your doctor, I'm a doctor, not yours. I
Yeah.
feel you could probably have a square of, but make sure it's
Yeah.
really good chocolate. Make
Yes,
sure it's
exactly.
worth it. That good,
Right. And
like
they
Belgian.
exactly. And that's what I do. Yeah. And it's true. The doctor tells me that's not a bad thing. That's a good
Mm-mm.
thing, dark chocolate. But that is so interesting. Now let's chat for a minute. It's interesting because I just watched RFK, and people who are listening, Robert Kennedy's
Yes.
um, speech,
Did you
which
well up? Did you well up a
I
bit?
did. I absolutely did. And to the point, I was so surprised and so saddened by the numbers, especially the shocker was that 1 in 22 children are going to have autism. I mean, that is insane. My mother used to work with autistic children, and it was hard. And these poor children, I mean, the fact that we're feeding them this crap to
Yeah.
make them sick. Yeah, I did well up. And I actually sent the video. Who knows if they'll watch it, but I sent it to both my kids. My son is in his 30s, but he's not married or has kids yet. But my daughter is 30, and she has 2 babies. So she
Mm-hmm.
has and she did listen. And I was just, it's so sad. And you can't help but believe the quote conspiracy theory. I mean, it is just too true. And I do think the sinister part of it is coming from the pharmaceutical companies. And
It's not a conspiracy, and it's unfortunate
exactly.
because I think so medical establishments, and I say this as a physician who works for a hospital, our goal
Hmm.
is to take care of people.
Hmm.
But the industry
Yes.
itself, if you don't have people who are chronically ill, there is no industry.
Right.
So
Right.
nothing, right?
Hmm.
And what's really interesting, especially with mental illness, and one of the things that I speak on frequently, like one of my most frequently requested talks is ketogenics and brain health, and talk about specifically ketogenic diet in bipolar schizophrenia. Amazing, amazing research into ADHD and autism. And it's fascinating that if you take away all the processed stuff, it doesn't matter what stage of life you're in. If you take that
Hmm.
away and have a ketogenic diet, it actually heals the brain very well. It's called the metabolic mindset. It's
Wow.
fascinating. And so there have been 3 or 4 just ground shattering research studies that have come out in the past 2 years. One from Stanford. They took patients who were inpatient
Hmm.
bipolar schizophrenic. So these were not functional.
Right.
They were
Right.
inpatients.
Yeah.
And they literally put them on a ketogenic diet. And over the course of about 90 days, one of the studies was 90 days, had 6 interventions with them, 6 interactions. They checked to make sure they were in ketosis. At the end of the study, and I might just get the data a little bit wrong, but about 80% of them were off all meds.
Wow.
They had improved their lifestyle, unhospitalized. They were out in society.
Oh my
And
goodness.
they had, again, remember, these were inpatients. These were inpatients,
Yeah.
florid
Wow.
psychosis. And we've known since about 461, I think, BCE. Hippocrates
Hmm.
said, let food be thy medicine, medicine be thy food. And one of the things he was referring to was, at that time, the only treatment for epilepsy was ketogenic diet. You essentially starved the patient, because if you starved the patient, ketones rose, and that is actually one of the treatments for epilepsy, a ketogenic diet. It
Oh.
has worked throughout the ages. When did it go out of favor? Well, it went out of favor in the 1960s-ish, in the 1970s. Why? Well, the drug companies developed the first seizure medications. The seizure medications are easy to take. A
Hmm. Hmm.
ketogenic diet is truly hard to keep in ketosis. It really, really is. You have to be very vigilant. It's very hard for children who especially like sweets.
Clarify for everybody just the actual definition then of
Sure.
ketogenic so that they.
So,
Mhm.
a ketogenic diet is a diet that is primarily fat and protein and has either zero carb or less than about 5% of your diet is made of
Okay. It's
carbohydrates.
carb.
It forces the body to use a ketone pathway for energy versus glucose. So the American Diabetic Association came under a lot of fire earlier this year because their new public director, the public
Mm-hmm.
is the former director of Kellogg's marketing, Kellogg's Corporation, and said diabetics can have up to 10 pieces of bread a day. And in fact, they should have carbs. You have to have carbs for energy. You absolutely do not. The
Mm-hmm.
alternative pathway for energy is ketogenics. So
I see.
having a diet that's less than 5% carbs, and everyone has different thresholds. Everyone has
Right.
different thresholds. But whereas medications for epilepsy, there's about a 30% failure rate and about a 30% intolerance rate.
Wow.
If you stay on a ketogenic diet, almost 70 to 80% of people have at least no seizures or very minimal seizures. But again, you have to be in ketosis. But it's very hard, easy to take a pill. And they did multiple studies side by side, different countries, different age groups, and patients with epilepsy would rather take a pill or many pills
Mm-hmm.
than follow a diet,
Wow.
which to
Yeah.
me is crazy.
Yeah. Absolutely. Yeah.
But
Yeah.
we've known that's how it works in the brain forever. And they're bridging that now into bipolar schizophrenia. There's an incredibly large study, a study group it's called the Brzezinski group. Chris Palmer out of Harvard, Georgia Ede, they both are highly involved with called brain health, metabolic mindset. Brilliant. They're
Hmm.
so brilliant. They're physicians, but they're very clinically oriented. So I can talk to you about the Krebs cycle forever, right? And you
Mm-hmm.
will roll your eyes back in your head and go, oh dear God, right? They are so good because they're practicing psychiatrists. They're very good and neurologists in translating the science into, it's like when we talk about statins,
Mm-hmm.
and utterly convincing, utterly convincing. And they're actively involved in research, and they have brought this field really to the general public, because I think one of the things that's most exciting about me, and to me personally, whatever you're conservative or liberal or independent or tree
Mm-hmm.
hugger, I don't know, whatever you are, I don't know how you can argue with if one of the tenets of your campaign is, I am going to make government transparent. I am going to make everything healthier that I can for children.
Yep. Yes.
Um, I don't know how you can argue with that.
Yeah.
Um, it's He's been apparently fighting for decades. I have to admit, I'm not so much into politics, so I didn't know a ton about him. I
Mm-hmm. Right. I
honestly,
didn't either.
right. And now hearing about his platform, hearing about everything that he has done,
Mm-hmm.
it makes sense to me.
Yeah.
I
Oh, it
like
absolutely
what is it,
does.
Make America Healthy Again, which I think is
Yes.
really going to upset some people, but that's,
I'm sure it
hey,
will, but you know what? I don't know. At this point, people need to see, do we want to continue 4 years that we've already had and repeat, or do we want to go back to something better?
right,
And that took it to a whole other level, because it wasn't just economics. It wasn't just,
right.
all of this other stuff about taxes, economics, all of that is important, but wow, the
Divisive.
fact,
It's very
yes, it
divisive.
is. But then you go to, yeah, don't we want to make our children and ourselves healthier? I mean, that
How
is
can you
just,
not? How
how
can
can
you
you not?
argue with
I
that?
agree with you. How can you not? Yeah.
And again, it doesn't matter what side of the aisle you're on, or if you're in the middle or
Right.
wherever. That's a very difficult thing to argue with. They say, oh, yeah, I mean, of course I want my
Yeah.
kids to be healthier than I am. And if that means that we kind of have to unroof kind of the shadiness,
Yes. Yes.
fantastic. Fantastic. Let's do it.
Yes. That's a great way to say that, Amy. Really. I like that. It's very true, because I feel like we just take, for fact, we take what the government says or these agencies say and we do it. COVID's the perfect example, the medications, which is why my mother passed, but
Mm-hmm.
they refused to she went into the hospital really with a heart issue,
Mm-hmm.
and they tested her for COVID. She came up positive, which she wasn't, because
Hmm.
she, at her facility, was at a nursing
Oh, I
facility
see.
behind my office here. And she was there, and they tested daily during that time. This was years ago.
Sure.
But they came up positive. And so I was coming back from a trip and, driving as fast as we could from California back to Arizona. And I said, do not admit her. Her cardiologist doesn't have privileges there.
Mm,
and she does not have COVID. I'd like you to do another test because and they refused.
mm.
Even though then you find out that Abbott, they were the ones with the tests, I guess, had discovered they were getting a 75% wrong. They were getting wrong positive readings and they were requiring
Yeah.
a second test. Well, so then they didn't. And then they put it on the COVID floor.
Mm.
And then when you ask for the medication that we all now know worked, the hospital and the pharmaceuticals would not allow it, would not allow it.
It was a very interesting time for those of us in medicine because it was
Right?
quite terrifying for those of us in medicine. I was actually working overseas at the time. I'm working on
Uh,
in Bermuda, an island with one hospital,
oh my gosh. Yeah.
28 ventilators for an island of 60,000 people. And
Mm,
every day something changed. And we
yes.
were all desperate to kind of keep up with it. We didn't know what was going on. Everyone was sort of
Yeah.
terrified. And as we kept trying to digest more information, and it became very, very clear to a lot of us very early on that something wasn't right.
Right.
There was something called the Great Barrington Declaration, and very
I know that.
quietly, a lot of us signed it. And it was essentially not saying that what we're doing is right or wrong, but we need to think about it. Something doesn't make sense. We're very
Hmm.
skeptical
Right.
of this. We, again, I think the majority of us really tried to do our best.
Yeah.
And still, I think we really don't know the right thing. We do know some things that work, some things that didn't. What we do know, however, is the vaccines that first of all, anyone who thinks that a vaccine will prevent disease from happening at all, that's not how vaccines work, ever. In
Mm-hmm.
the
Mm-hmm.
history of the world,
Right.
has never
Right.
worked.
Right.
And the second the government came out and said, if you take this vaccine, you will not get the disease, all of us in medicine went, well, that's okay. First of all, it's ridiculous. And second of all, now we
Mm-hmm.
just are not going to believe anything you say.
Interesting. Yeah.
It
Yeah.
was a really interesting thing because so being a US citizen and living we were the British Overseas Territory. We all needed to be vaccinated. In the hospital, you had to be vaccinated. So it was a bit of a catch-22.
Yeah.
If you weren't vaccinated, you couldn't work. If you couldn't work, you couldn't stay on the island. But if you weren't vaccinated, you couldn't come back to the United States.
Oh my goodness.
And trust, I am very pro-vaccine. They have saved millions of lives.
Mm-hmm.
I had concerns about this one.
This one. Yeah. Yeah.
But what I was seeing in front of me, though, if you were vaccinated, you actually did a lot better in that population. Fine.
Hmm.
But it was a very difficult time for us as physicians because we just were really struggling with, we don't know what to do. We don't know what to do.
Yes.
And as
Yes.
helpless as our families felt, we felt that on our end as well because we just felt we couldn't fix
Oh, I
anything.
bet it must have been a very frustrating time because, yeah, first of all, you're being told what to do and not
Hmm.
necessarily go with what your feeling or gut is.
Right.
I'm sure, and a lot of doctors' hands were tied and had to, and it
Completely.
was just a mess. But yeah, yeah, absolutely. But I do think that there is something going on with the pharmaceutical companies
Oh,
that
no
that
doubt.
is way too shady. Yeah, and it's sad that as Americans we just fully rely on it. I mean, I did until probably until COVID, and it opened my eyes, and I'm like, something is not right here.
Well, the thing that I think got a lot of people's attention, and I don't know if it happened. I think it came to light about a year or two ago. So pediatricians' offices were given bonuses by the pharmaceutical companies if they did X amount of
Mm.
vaccinations per month, and the bonuses were $20,000 to $40,000.
Oh my.
And that is that goes above and beyond the, oh, thank you for doing your civic duty.
Yeah, Yeah.
40,000, and it was one of those things that, again, us in medicine, where we're going, wow, if you have to pay a bonus.
Mm-hmm.
And so
Hmm.
it's just one of the things that we all sort of took a step back. I think the downside to that, though, and we're now seeing the unintended consequences, we're seeing measles,
Mm-hmm.
measles again, which is, people are like, oh, it's measles, it's fine, just a rash, except for the fact that in a very small population, but still there, they get a horrible brain infection and
Oh,
either
wow.
die or they're completely disabled for the rest of their life. We're seeing diseases that we have not seen in decades because now no one trusts the government.
Right.
So
And that's not good either.
it's
Exactly.
not good
Mm-hmm.
either. No,
Mm-mm.
no, no.
Mm-mm.
And so it's a very challenging place as a physician. And sometimes it's funny because when I do talk to a lot of conferences, like wellness conferences, or people who are very interested in paleo or natural health, people have very strong opinions about all medications. And it's very funny. I swear I have this conversation at least once a day with people. Oh, it's natural. It's natural. I'm like, cyanide's natural. Cyanide's natural. It does not mean it's good for you.
That's
Please,
great. Yeah. Yeah.
please don't do that. So it's
Yes.
a very challenging time to be a physician. But I like, that's my cyanide's natural. Please,
Yeah. Please don't take it.
please don't take it. Don't do that. Don't
Right.
do that. I know.
This has been so amazing. In fact, I would love to have you back to talk about, because I know it's going to be another big topic, just about women, hormones, fertility, kind of that entire
Would
thing and
love
kind of
it.
what is happening there. So we will do that. So
That would
thank
be
you.
wonderful.
I would really love to, because this has been eye opening, I'm sure, for a lot of people hearing what we've just talked about. And I'd love to give people a bit of time to go listen to Robert Kennedy's talk and then come back and we do this again, because I don't know how many have heard it. It really does kind of round
It
out.
resonates. It
It does. It
resonates.
resonates and it will round out the conversation and knowledge here. So Amy, if people want to, do you work individually with people or not?
So I'm clinically an emergency medicine physician. I work nights. They kind of tuck me in the corner. It's okay.
Uh-huh.
But I tend to not do one-on-ones. I have some small groups, and
Okay.
I grew up in fire and EMS, and they tend to be fire and EMS people, and I tend to be the rah-rah. But I primarily do group lecturing and conferences, and do a little research here and there. But I don't do one-on-one. I think at some point in my life, I would love to do that as I sort of like
Mm-hmm.
venture out. As one gets into one's 50s, it's as fun as
Oh,
it is
I
yes,
know.
as you know.
This started for me when I was 50. I mean, doing this podcast it's kind of, you start to see where you want to make an impact, where you want to
Absolutely.
leave a legacy. Yeah. Yeah.
And so for me, it's a way of actually kind of repenting in a way for all the time that I spent thinking I was doing the right thing. I believe there are sometimes good doctors doing bad work and bad doctors doing good work. I would like to think that I was never a bad doctor,
Oh, of
but
course. Yeah.
this is my way of doing repentance. And so I tend to do
Interesting.
large conferences, some small conferences,
Mm-hmm.
podcasts, and I try to share as much with as many people, because even if you don't believe a word I'm saying, hopefully it piques somebody interest and go, she's ridiculous. I'm just gonna look it up because she's being ridiculous. And then, they hit the old
Then
Google or
they,
whatever it
yes.
is and
Yeah.
go, oh,
Maybe not. Yeah.
maybe she's not. So
Yes.
that's what I do. And I have, if you want to book me and pay me lots of money, that's fantastic. Otherwise, having lovely conversations like this. But my website is www.toughlovemd.expert. I'm
Okay.
ToughLoveMD because I tell
Love it.
people, I tell people, if you are 400 pounds and your knee hurts, there is something that we can do about it. If you're short of breath
Mm-hmm.
every day, but you're still smoking 2 packs, maybe we can tie those two things together.
Yeah.
But yeah, toughlovemd.expert, and you can always reach out to me. always happy to talk. I would love to talk again about women and
Yes,
hormones, but
let's do
I would
that.
ask that you teach me something about architecture, though. I
Okay,
would
we will
love
share on
to.
that. That would be great.
Absolutely.
And that way, I'd also like, so listeners out there, if you have specific questions from what we've just talked about, send them over to us. You can email me directly, Karen at otiswebstudio.com, and go ahead and do that. And we will get Dr. Amy to help us answer some of those on our next one. Fantastic.
Wonderful.
This has been so enlightening. Thank you so much, Amy. I really
Such a
enjoyed this.
pleasure. Thank you so much for having me. I really appreciate you, and I hope you have a great day.
Thank you.